everyone. Welcome to the Engage Africa Foundation's Digital Festival in 2022. We are honored to invite Dr. Tunde Omilola. He joins us today as head of the Development Planning and Inclusive Sustainable Growth Team at UNDP and the head of the Public Health Division of the African Development Bank Group. Dr. Omilola's past work includes serving the International Food Policy Research Institute as the Africa-wide coordinator and program leader for the Regional Strategic Analysis and Knowledge Support System sector. Previous to that, Dr. Omilola also served 2 years at the Food and Agriculture Organization of the United Nations. So hello, Dr. Omilola, we're so glad to see you here today.
I'm very pleased to join you today. Thank you for inviting me.
Of course, yes. So my name is Preetha, and with me is Yisheng Chow. We are both part of Engage Africa's Foundation Festival team. Thank you for this opportunity to engage in an interesting dialogue on how governments can encourage healthier communities. We're really excited to dive into this topic with you. So to kick off the conversation, I'll begin by asking you to reflect a little bit on your background with strategizing efficient funding structures for health programs. In doing that, in your opinion, what does it take to create healthy African communities?
Thank you very much for inviting me. In my career, I have worked with many governments around the world, not only in Africa, but also in Asia, in the Pacific, in the Caribbean, in Latin America, as well as in Europe. And what my experience has shown me is that investments in health is extremely important. And not only that, but in terms of how you allocate resources in any government, anywhere in the world. And Africa is a very, very special example in terms of allocation of resources, but also expenditure. We have a continent, Sub-Saharan Africa, where 30% of total expenditure in health is coming from pockets of people in Sub-Saharan Africa. So which means that's a lot. And that's why when you also look at the resources the governments themselves put into the health sector in Africa, they tend to lose 20 to 40% of these resources because of misallocation of resources, corruption, but also in a way that resources are not properly allocated, but also when they are allocated, they are wasted because of lack of absorptive capacity in some governments. So as a result of this, it becomes very fundamental to allocate resources very, very well, but also to ensure equity in terms of spending. Efficiency in spending is very, very vital. And that's why you see a continent where we are currently losing around $2.4 trillion as a result of poor health, lack of investment in the health sector. At the same time, it's a continent where our nominal GDP, gross domestic product, is around $2.6 trillion. And when you juxtapose that with what we are losing as a result of poor health, you can see that we can actually increase economic productivity of the continent if we invest more in health and we allocate resources very properly. So what am I saying? I'm saying that investment in health is extremely important for economic development, for economic productivity, for economic growth of African countries. And if we don't allocate these resources properly, then we are in trouble. And that's why the role of governments become extremely important, not only in terms of allocating resources, but also in terms of engaging multi-sectoral partnerships in the health sector and bringing the private sector on board and allowing many other sectors, in any particular country to engage in the sector and to play their catalytic roles to make sure that we have healthier communities in Africa. Thank you.
Yes, thank you so much for your response. I see the importance of investing in health, especially learning about high out-of-pocket expenditures with 30% being out of pocket. and so many other ways to improve the economic status of various countries and the wealth of people as well, just by investing in health. And you bring up a great point of how the government can improve this and kind of intervene and offer this multi-sectoral approach, which leads me to my next question of asking, what would you say the role of government is in creating healthy communities? And do you have any examples of a successful partnership with governments that promotes health?
Thank you very much. Governments around the world, including in Africa, have committed, to attaining what we call universal health coverage, UHC, which is part of the Sustainable Development Goals, which governments of the world agreed upon in 2015. Basically, by universal health coverage, it simply means ensuring that all people can have access to healthcare that they need without suffering financial hardship. Now, what is going on from the analysis I gave earlier on, 30% out-of-pocket expenditure from total health expenditure in Africa is just too high, and which means governments have to step in. And for government to step in, you have to step back and look at where Africa is compared to the rest of the world. As you know, Africa, with just 15% of the global population, we bear 24% of global disease burden. And 50% of all deaths as a result of communicable diseases occur in Africa. So those are highly relevant statistics that show that governments in Africa must step in. And now, what can government do? The first and foremost thing that the government can do is to promote and protect health as a human right of all people in Africa, fundamental human rights, in terms of controlling diseases, not only when we have emergencies, such as the global COVID-19 pandemic, which a lot of governments have really responded to. Not only that, but in terms of long-term health development planning in countries, governments have to play a critical role to be able to ensure that the health needs of populations across Africa, they experience equity, efficiency, but also in terms of carrying out vital public goods. And that's why governments have to step in. Remember that, improving health outcomes deal with so many other issues, the social, the political, the economic, the environmental, the cultural determinants of health. Governments have to play a role to make all of these determinants of health to work well in different countries. The second thing that governments have to do, we have to make sure that health is not seen as something that belongs to the ministries of health alone, but bringing on board different other ministries, different other sectors, whether the agriculture and food sector or the social services sector. All of those are extremely important, and governments have to play a catalytic role here. The other thing that I believe governments have to do, it will be in terms of effective policies, in terms of regulatory controls for service delivery around health. And that would really help the private sector to come on board and play their own role. And so governments have to do what I call provide the enabling environment for public-private partnerships in the health sector to work well. You look at Africa again, only 10 to 20% of investment in the health sector in Africa is coming from the private sector. This is not good for the continent. So the government have to step in to make sure that we increase the amount of resources, investment from the private sector in the health sector in Africa. And that can only be done through public-private partnerships and platforms, which governments can bring to fruition in many countries. In addition to that, when it comes to universal health coverage that I described earlier on, we have seen some notable, useful examples around the world where this has worked well. You look at Brazil, you look at France, you look at Thailand, you look at Japan. Universal health coverage has really been going on well in many of these countries. Let me give you the example of Thailand. Thailand as a country, before it invested in universal health coverage for its people, they were experiencing all kinds of impoverishments, people dying, infant mortality was very high. But a decade after they introduced UHC, universal health coverage in Thailand, they saw dramatic reduction in infant mortality, dramatic reduction. The statistics from 24.1% to around 13.9% within a decade in infant mortality rate being reduced in Thailand as a result of universal health coverage. So many other governments in Africa can begin to replicate such great examples that we have seen in Brazil, in Thailand, but also in Japan and France, which are developed countries, of course. And I also believe that another thing that governments can do will be in terms of human resources for health. You look at Africa, we train our medical professionals, medical doctors, nurses, and all of them using public resources in Africa. And immediately we finish training them, many of them, they move to other parts of the world. They go to Europe, to North America, even to Asia to practice. And so we have what you call the brain drain in the medical space in Africa. So one of the things the government can do is to create the enabling environment as well as enabling infrastructure and conducive environment for our medical professionals to thrive back in Africa. Take, for instance, Nigeria. Nigeria has more than 35,000 medical doctors practicing in the United States of America alone. This is outrageous compared to the number of medical professionals back in Nigeria. The same, you can say, for many other African countries. So governments can leverage what I call diaspora platforms to also make sure that the brain drain we are witnessing in Africa in terms of medical professionals, we turn it into brain gain. And other countries have done this. India has done this. In India, I'm sure, I suspect you are from India yourself. And I know that in India, through diaspora platforms that the government of India created, 9 of the top 15 hospitals today in India are as a result of diaspora involvement and investment in health in India. And so that's the kind of thing that governments in Africa can also do. That's by giving all kinds of tax incentives and other incentives for the diaspora to invest back in health sector in Africa. And this can be done through many ways. The COVID-19 pandemic has shown us you can use digital health, telemedicine, innovation in health service delivery will also be very critical in this way. So those are some of the areas where I believe governments in Africa can play a big role in ensuring healthier communities across the continent. Thank you.
Thank you so much for your comprehensive response. I really appreciate you explaining the many platforms governments can intervene in, especially with building that gap between public and private sector, as well as it's very interesting to learn about this brain drain concept and how resources are limited in various African countries, and that governments can improve policies and regulations and incentives, as you mentioned, to improve that process. And you previously related this to communicable diseases, but I'm curious how that relates to government intervening in multi-industries to prevent and manage non-communicable diseases. Do you think that there's a way that governments are able to do this in multi-sectoral approach?
Well, as I said earlier, there are what we call the communicable diseases and then the non-communicable diseases. 50% of global deaths as a result of communicable diseases occur in Africa. This is huge. This is unacceptable. And so when you look at non-communicable diseases, many countries in Africa are also now experiencing non-communicable diseases, especially in our middle-income countries, whether lower or upper middle-income countries in Africa, as a result of what people eat, what people consume. And that malnutrition affecting so many of our young people in Africa, especially children under 5. And that's why today we have about 159 million stunted children in Africa, more than any other region in the world. And this is also affecting what you call issues around wasting, obesity, and as well as young children and even women and adults are experiencing all kinds of non-communicable diseases. And so the food industry becomes a particular industry that governments need to work on in terms of regulations, in terms of policies, but also in terms of actions by working together with the private sector around that area. The other issue that should happen is to set up what I call multi-sectoral interagency task forces in different countries around this area to monitor the regulations that we put in place, but also for legislations to happen, especially in our parliamentary houses. You know, parliamentarians need to come in. We need legislation in terms of how these can be governed properly, especially working with the private sector. So those are some of the areas where I believe governments will need to come in when it comes to dealing with non-communicable diseases in Africa.
Thank you so much for your response. I really appreciate you explaining the interagency approach and making sure that there's not only implementation, but also an ability to regulate and follow up and, you know, evaluate how programs and implementation is going. Another question I had for you is that, well, we know that health is not only created in hospitals and clinics, it's also created in living conditions. So what would it take to have communities that have access to walkable streets, green spaces, clean air, healthy food and nutrition, other living conditions that would help promote health in communities?
Yes, you know, as you know, health is a big issue, and because it's an important issue, it has effects on economic development, on economic productivity, in terms of security of even a country. Health is extremely useful, and we have also seen that infectious diseases can spread very rapidly across the world and can destabilize global economies and can affect different economies in different ways, and people suffering hardship, people slipping back into poverty. So the role of communities become extremely important. And that's why, for me, I always believe there must be clear roles and responsibilities for different actors that will help improve health outcomes in different countries or in different communities or different societies. And so in terms of creating that space, we need to work more with mayors of cities, with urban leaders in particular, to create space for people to be able to do what they need to do. I have seen some countries where they have invested massively in opportunities for people to have space in urban areas, in cities, in terms of being able to do exercises, in terms of stemming the idea of non-communicable diseases, making sure people eat well, eat healthy food, but also the exercise. I've seen that in Dakar, for instance, where I was a few weeks ago, you know, where people are now, you know, doing joint community exercising, you know, living healthy, eating healthy food, and all of that. So we have also seen in many other cities around the world, which I believe many countries in Africa can also replicate and emulate in terms of creating the green space, in terms of encouraging people on what they eat, in terms of also putting some measures to curb all kinds of activities that can lead to poor health in countries. So we've seen countries that are rising to that occasion, but there are some countries that are still lagging behind. And that's why we've also seen what can happen when the economy of a country is really very productive in terms of healthy workforce in a country. So all of these are interrelated. You need a healthy workforce, and for that healthy workforce to happen, governments have to play their roles, you know, communities have to play their roles, and private sector also has to play its own role. And all of these have to come together in a way that somebody must be driving it. And that's why the governments should be at the center, driving this kind of agenda. And governments in some countries are at federal, state, local levels. And so we cannot limit this to government at the center, you know, I mean, at federal level. You need more local communities, local governments to play great role in terms of creating that space, creating that environment for health to thrive, for people to be in good health. And so that's why I spoke about the social, economic, cultural, environmental, political determinants of health. All of these have to come together, and for this to come together, you need government at the center to play that role, to facilitate and to encourage and to legislate, and also to put measures in place where when certain things are not done, certain things are enforced. When people have that kind of enforcement mechanisms in place, they are likely to follow a healthy lifestyle. So it's all about healthy lifestyle for us in Africa, for us to be able to really deal with non-communicable diseases. Thank you.
Thank you so much for your response. I really like how you also explained that government is not just at the federal level, it's at every level, and that local governments can also institute different policies and regulations to encourage a healthy lifestyle overall. So thank you for explaining that. And I've really appreciated our conversation so far, and I'm going to pass it off to Yisheng to continue the questions.
Yeah, thank you, Preetha. Hello, Dr. Omilola, nice to meet you. And I would like to extend your previous discussion with Preetha. Could you give us a concrete example of comprehensive investment to prioritize the health and the well-being of vulnerable groups? For example, how do you ensure that people living in the slums or people have disabilities to access green space and leisure activities?
Thank you. Thank you very much for that. Are you done?
Yeah.
Okay, great. There are many examples that are banned. And, let me go back to the example of Senegal that I gave earlier on, where government is providing the overall stewardship of the health sector in that particular country. But the government is working in collaboration with other relevant sectors in a multi-sectoral approach by making sure that there are other sectors involved, not only the health sector. You have the agriculture sector, you have the urban planning sector, you have the environment sector, you also have the planning sector, and even the finance ministry of the government being involved. So by leading in terms of policy formulation, in terms of regulating service delivery, especially service delivery from private sector entities, which is extremely useful. Also by developing norms and standards for quality assurance and ensuring implementation of agreed strategies. We have seen what the government in Senegal is doing. Many other governments also doing this. And so I think governments in Africa can continue to champion the health of their citizens by, of course, putting in place mechanisms for transparency, for accountability, especially in terms of resource use. Efficiency of spending in the health sector is critical. I think the idea of wasting 20 to 40% of expenditures in health due to inefficiencies is a very terrible idea for the continent. We can no longer continue to waste limited resources through inefficiencies, in spending, especially when we're looking for more resources. So that's what we have seen. But we have also seen in some countries where absorptive capacity is very, very low. They have the resources, they have the money, but when they do the allocation, they are not able to absorb these resources critically in the health sector. I give you the example of South Africa. At the time I was based in South Africa, I was the chief economist for UNDP in South Africa. And the government of South Africa was finding it very difficult. South Africa has 9 provinces, what we call 9 provincial governments, in addition to the national government of South Africa. Now, when they do allocation of resources to these devolved 9 provincial governments, you discover that many of them have weak absorptive capacities to utilize the resources. So one of the things I did for them at that time was basically to help them utilize the resources by getting thorough medical professionals for them through the UN volunteer system. And then I was able to bring in medical doctors from different parts of the world, from Pakistan, from Asia, into South Africa at that time, especially in a province called Limpopo province in South Africa. So these are some of the things that we see in Africa. You have some governments, middle-income countries, where the resources are there, but they are not properly allocated. And also there is weak absorptive capacity. Then there is also inefficiency in how they do the spending in the health sector. So what can happen is ability to be able to help governments to spend their resources very well. And so there are many examples in Africa where some are doing well, some are not doing well. So I've given you a very good example where government is providing the policies, the regulatory frameworks, but also the partnerships to do great stuff in the health sector. I've also given you another example in South Africa where there is weak absorptive capacity, and which is affecting the utilization of resources for health, which of course also means that the health of the citizens is in shambles, basically. And that's why you find non-communicable diseases rising in that part of Africa. Thank you.
Thank you, Dr. Omilola. That's a great to hear about your experience about that. And I believe these points can also be used for like the intervention focused on the vulnerable groups in the future. And as you say, allocation of resources is very important. Food is one of the main resources for people living. It's a definition of the health promotion in the Waterworld Charter. It indicates that food is one of the most prerequisites for the health. I have seen that you have a lot of working experience in the organization related to the food policy approach and the food accessibility. Depending on your experience, why do you think the food resource is that important for population health, and what is the role of the food resources in the health of African communities?
Food resources, you said?
Yeah, food resources.
Oh, very good. I've worked in two preeminent global organizations for food in the world, the International Food Policy Research Institute and the Food and Agriculture Organization of the United Nations. So basically, food is everything. What you consume is what you become. So now, in terms of that, I think, people working in health generally, one of the fundamental errors that they have made over time in the last decades is the inability to work with other sectors, especially the food sector, the social system, social protection sector, but also the water and sanitation sector. All of these areas, they have implications for health. Let me give you a very, very good example, again, of Nigeria.
Yeah.
Nigeria, at every point in time, officially has about 25,000 primary health care facilities. And, only 20% of them are functioning because the others, they lack access to water, to sanitation, to, food resources that are useful for those who are being treated. And as a result of these, people die of preventable diseases. So now, the role of food is critical. It is about nutrition, not just food. People can have access to food, but it's about having access to nutritious food in the world, So now that's why health and nutrition need to come along as one entity, in terms of, the nutrition, what is being consumed, and how that relates to the well-being and health of people is critical. And that's why the food industry is extremely critical for health. And that's why there must be legislation, there must be regulatory frameworks and policies in place in terms of food that is being produced for people to consume. In Africa, as you know, Africa produces food, but the food that is being produced in Africa is not enough to feed the people of Africa. Why? Because despite the fact that Africa has about 70% of the global arable land, there are many other factors that affect our food production. One of them is as a result of market failures, and that's one of the reasons why government need to step in terms of playing a catalytic role dealing with market forces also to make sure that food is produced and consumed well, but also that, when you process food, how you market that food, the point where it goes from production to consumption. All of these areas need to be interrogated for us to see how food then becomes an important element for the health sector. So those are some of the areas that require public authorities to intervene and not just to leave everything to market forces when it comes to food. So governing the food industry is extremely critical and appropriate for designing, policies that can help for people to have access to the best health that they can have, for us to have improved health services. So that for me, I think is critical. Another thing that is critical, it is these public-private partnerships that we talk about all the time. When we talk about it, we don't really specify the roles and responsibilities of the public sector and the private sector properly. And that's why private sector people tend to do whatever they want to do when it comes to food that is being produced and that is being marketed. So now governments have a better role to play, critical role. Governments have to regulate, and provide legislation for the kind of food that is being produced and that is being marketed, that is being packaged, that is being processed before they move from point of production to point of consumption. And that's where the government needs to play that role for food to become very useful for improving health outcomes of people of any particular country. Thank you.
Thank you. Thanks a lot for your given example here. And I see that you have indicates the market failure and about the critical about the food industry in the Africa. As you said, the government should play the central role in the health promotion program. Like, what is the character of the government when they play the role, joins the health promotion intervention with the organization like the African Development Bank and the WHO?
Correct. The African Development Bank is a multilateral development bank, an international financial institution. And, for us at the African Development Bank, we have been in the health sector since 1975. And we have our regional member countries, all the countries in Africa, as the members of the bank, but we also have non-regional member countries, that are part of the share holding of the bank. You're talking about the UK, the US, Japan, China, and the rest of them. Yeah. Now, the main issue for us is to support our regional member countries by providing not only financial resources, but technical assistance, policy, knowledge for them to be able to provide the necessary health and also public goods for their citizens. Now, in doing that, what we have seen as African Development Bank, we have seen that our area of comparative advantage is in terms of health infrastructure in Africa. And, we have also seen that Africa requires much more financing in the health sector for it to thrive. Africa actually requires $66 billion every year in the health sector. And out of that, $26 billion is specifically required for health infrastructure in Africa to be able to reach the standard that it should be for citizens. And so one of the things we do is to leverage financing for African countries, provide some of the resources they need, but also connect them to the markets. And so one of the things we do, we also provide resources even for the private sector in terms of non-sovereign operations to come into the health sector. And that's why for the very first time in the history of the bank, we have crafted a strategy for quality health infrastructure in Africa. And through that strategy, we aim to do three things, to build what you call, African healthcare defense. And in doing that, first and foremost, to deal with the healthcare infrastructure of the continent, primary healthcare facilities, secondary and tertiary healthcare facilities, diagnostics health infrastructure, but also now much more to also deal with the pharmaceutical industry, to support local pharmaceutical industry in Africa in terms of manufacturing pharmaceuticals. As you might know, Africa imports 70 to 90% of its pharmaceutical goods. And at the same time, Africa only produces 1% of vaccines that it consumes. And that's why when COVID-19 pandemic hit badly, it was so difficult for many African countries to get the vaccines that they need. So one of the things we are doing at the bank is to stimulate local production of pharmaceuticals and vaccines to be able to do that African healthcare defense. But we also work with the World Health Organization very closely. In fact, we leveraged about $54 million to World Health Organization to support our regional economic communities in Africa to be able to respond to COVID-19 pandemic adequately in terms of strengthening African health systems, stabilizing African economies, and all of that. We also leveraged about $27.33 million grants. These are grants to the African Centers for Disease Control and Prevention to be able also to build its capacity and to respond to the COVID-19 pandemic through its regional collaborating centers across Africa. For us, we believe that we cannot do it alone as African Development Bank. And that's why we work with other partners. With the World Health Organization, we have been working together under what we call the Harmonization for Health in Africa. And one of the things we have done, we have produced some knowledge work. One of them is around public-private collaboration tool to achieve universal health coverage in Africa. The other one is the value for money guide in the health sector to deal with some of those inefficiencies in public health expenditure, but also to deal with how you do it with allocative spending and efficiency in spending of resources. So, and most of our work we do with governments, our regional member countries, but we also work with the private sector entities. And as more and more we want to do more public-private public goods, you know, in terms of investments in the health sector in Africa. Thank you.
Thank you. Thanks for your explanation, and that gave us a complete overview of the government's role and the organization's role in the health promotion program here. Based on the relationship between the finance, the food accessibility, especially the healthy food accessibility and the health, do you have any good example of the food supply chain intervention to improve the accessibility of healthy food in African communities? The intervention can be placed in any specific area or African country.
Well, as I said earlier on, we believe that the food industry is critical. One of the things we are doing as a bank right now, as African Development Bank, we are responding to the food crisis that is emanating from the ongoing war in Ukraine by ensuring that our board approved what we call a $1.5 billion food emergency crisis support in Africa. And what that is doing is around the food supply chain to look at from the point of production, first and foremost, providing the badly needed inputs for African farmers, especially smallholders, in terms of fertilizers, in terms of seeds, but also in terms of drought-resistant seeds to be able to deal with challenges of climate change in Africa. And so through that, we're dealing with the food supply chain from when food is being produced, how they are processed. One of the fundamental problems with the food industry in Africa is because of lack of value addition in terms of processing, but also in terms of post-harvest losses. When food is produced, when it moves from the point of production, from farm gate to, the point of consumption, there are a lot of post-harvest losses that we see, especially for perishable commodities in Africa, talking about tomatoes and the rest of them. So one of the things we're dealing with is how to deal with that food supply chain and to make sure that what farmers and smallholders are producing, they are healthier food that can be easily processed in a way that value is added and then packaged properly and working through the entire food supply chain in terms of the marketing of the food before it gets to the final consumer. So it's from fork to the table, it's from production to consumption, the entire food supply chain. And right now, our board has approved several projects under the Food Emergency Crisis Support, from the $1.5 billion that I mentioned earlier on, based on the crisis going on right now in Ukraine. So this is a very, very recent example that is going on, that we are doing something very dramatically different from what has always been in the past, in terms of making sure not only that we work with governments of countries in Africa that get the support from the bank, but also working with the private sector entities that will ensure that we have healthier food along the entire food supply chain, from production to consumption, so that can then affect the health of our populations in terms of improved health outcomes. And therefore, we can also deal with issues around non-communicable diseases in Africa. So for us, we have seen the interrelationship between the food industry and the health sector, and we are taking advantage of our new resources at the bank to ensure that food supply chain that will be very useful to improve the health outcomes of our population. Thank you.
Thank you. Those were pretty interesting example. And as we know, the food supply chain can influence the different social and environmental factors, and it can restrict the healthy food accessibility in Africa. For example, the Ethiopia, it has experienced the following results from the climate change, and it relates to the decreased precipitation and increased temperature. This environmental change can affect the production of crops and other agricultural products and livestock in Ethiopia. In this case, and as you said in the previous example about the industry, food industry, which is the financial part. How about the geography effects? Like, are there any proactive efforts you are notifying the African governments can take to reduce the impact of the climate change on the food production?
Thank you for that. Talking about the example of Ethiopia, I was in Ethiopia last week myself, discussing with the government of Ethiopia. I met with the Minister of State for Health of Ethiopia. And one of the conversations that we had when I was discussing with him, it's about what's going on in Ethiopia right now in terms of the geography for production, the effects of climate change, the kind of crops that are being cultivated in the country, but also how to reduce malnutrition. We have a project, which example that I will give is called the Quota Declaration Project for Ethiopia. It cuts across two regions of Ethiopia, the Tigray region as well as the Amhara region. And as you know, the current crisis or war that is going on in Ethiopia is happening in the Tigray region. So as a bank, we provided a grant for the government of Ethiopia to basically help them reduce malnutrition. We call it a multi-sectoral malnutrition program, which cuts across food, health, climate, as well as the environment and geography of production, in terms of making sure that when food is being produced, it's healthier food that young children and their mothers can consume, and can reduce the level of stunting in the area. But because of the ongoing war in Tigray, we couldn't go to Tigray, but my team went to the Amhara region to basically monitor the project and see the effects of climate change on production, especially making sure that healthier food is being produced, and making sure that water and sanitation are also very vital parts of reducing malnutrition, and also dealing with some non-communicable diseases that we also see coming up among some of the people in that particular part of Africa. So these are some of the things that are ongoing, and we have been part of it. So the example of Ethiopia is an extremely useful example. It's also useful because when I discussed with the Minister of State for Health in Ethiopia last week, he told me about the investments in Ethiopia health extension workers, which is extremely beneficial in terms of diffusion of knowledge, information, in terms of healthier food, but also that they train these health extension workers within a short period of time, and that it mirrors what is happening also in Brazil, which then help them to deploy these health extension officers who advocate, for healthier food in terms of production, in terms of the geographies of production, but also in terms of mitigating against the impact of climate change. So all of these are intertwined. And that's why development today cannot be seen or approached in silos. It has to be integrated development, across different sectors. And that's the only way we can have improved health outcomes. And so this knowledge, this campaign is only just now beginning to gain ground in different African countries, that health cannot remain alone as a silos. It has to interact with food, with agriculture, with environment, with climate, with finance, with planning, with water and sanitation. All of these have to come together. And the role of the government is to bring all of this together by creating that multi-sectoral platforms and interdepartmental working groups for that to happen. And that's exactly what we are doing for the project in Ethiopia through my discussion and conversation with the Minister of State for Health of Ethiopia. Thank you.
Yeah. Thank you, Dr. Omilola. It's nice to hear the plan for preventing the food resources in African countries. I believe this action can really help the population to reduce the barriers of the local agricultural development and the food resource accessibility, and to benefit the health in the African communities. And also that can lead us closer to the ultimate goal to eliminating the food insecurity and promoting the overall health of the African countries. Thank you.
Thank you very much.
We are we have reached the end of the conversation, and we want to thank you for thanks for Dr. Babatunde Omilola to join our Engage African Festival panel discussion today.
Thank you for having me. It was a great pleasure to interact with you. Thank you.
Thank you
so much.
All right, thanks, and bye for now.
Thanks.